we know as a country that we spend a huge amount on healthcare. We're approaching 20% of gross domestic product. There's meaningful waste, and the outcomes are not what we should be achieving as a country. How do we make sure that the dollars we're spending are being as effective as they possibly can be? Our belief is that technology solutions play a critical role.
Healthcare in America isn't just complex, it's chaos, with the information and power stacked against employers and patients. On Margin of Care, we set out to rebalance that scale. Today's guest is a legend in the world of digital health startups. As co-founder and managing partner at 7Wire Ventures, Lee Shapiro has spent the last 20-odd years backing some of the most important companies of our time. 7Wire was an early investor in Livongo, where Lee went on to serve as CFO, guiding its IPO and eventual merger in what became the highest revenue multiple valuation in digital health startup history. He served as the president of Allscripts and the board chair at the American Heart Association. Lee is much more than an investor. And for anyone who's interested in where this industry is going next, you'd be hard-pressed to find a brighter mind. Such a pleasure to have you on the show today. Thanks so much for joining.
It's an honor to be here. You've had some great guests, and so it's a privilege to join them.
Lee, you've coined this idea of the quote-unquote informed, connected health consumer. Can you maybe just unpack that a little bit for us?
Much of our work early on was using technology to address what we saw were challenges in the delivery of care. What we realized is that much of what we were doing was substitutive, but not transformative. We were making things more efficient. We were substituting, for example, paper records for electronic records, but we hadn't yet built the capacity to really leverage those technologies, pull that data, and use it to better guide and make decisions about care. We also realized that our healthcare system is built to address the needs of acute illness. If you break a bone, if you need surgery, but we want to get healthy and we don't want to be engaged with the healthcare system anymore. We want to live our lives. And yet, if you have a chronic condition like diabetes or hypertension, you're living with those every day. And unless you're married to a provider who's going to give you guidance and you want to listen to your spouse, then you're really not in a position to navigate that well on your own.
Right.
So the thesis for our fund, the Informed Connected Health Consumer, is how do we give people the information they need to navigate towards that end state of health? We think patients aren't patient anymore. We aren't someone who wants something done to us. We want to be active. The notion of being a consumer is that you're actively engaged in making the decisions about what it is you're receiving and how it is you're being served. And so the companies that we support, the founders that we're backing, have had lived experiences with some of the challenges that they faced in addressing the healthcare system. We're helping them build companies that are trying to build more informed, connected health consumers.
What are some of the themes that are top of mind for you these days? You know, we've got employers that are facing near double-digit cost increases from an employer medical trend line perspective right now. They can't cost shift anymore because they're making things just so unaffordable for members of these employer-sponsored plans where they're functionally uninsured right now. Like, what are you seeing right now from the employer perspective pertaining to digital health solutions at this really challenging time for employers right now?
We have a formula for success. It's not proprietary. I'm happy to share it here, but a little bit of a trade secret. We think there are three elements that are critical in terms of being able to build great companies in this market. First is you have to understand the consumer journey. What's broken now, and we do a lot of work, something we call consumer hassle mapping, where we understand what's the status quo, what does that look like, and where are the challenges that people are running into in terms of accessing the type of health that they're achieving. When you do that, you're giving someone something of value, and so it becomes a virtuous cycle. They keep coming back because they're getting value. They say, this is so much better than the way it used to be. It's like the experience of trying to hail a cab in the rain versus being able to call Uber. And if you can build something that people love and they see value from and they keep coming back to use it, the second element that we look for is a demonstrable, objective improvement in outcomes. And so it has to be something that's measurable. You have to be able to show that what occurred previously and what is occurring now is better in a measurable way. And if you're able to measure those outcomes, then you're now able to go back to the third pillar here to who's ever at risk for the cost of care, the self-insured employer, the health plan, or the government, and be able to show them a return on investment. And we think that has to be a minimum of 2 to 3x in terms of being able to build a successful company, because you need to change not only the behavior of the consumer, give them something they love, but also the buyer. You have to make it worth their while to make a change to adopt that solution. So you ask, where are employers focused today? Absolutely focused on the challenge of rising cost of healthcare. We're approaching 20% of gross domestic product. General Motors is not in the car business. They're in the health insurance business because of such a huge percentage of every automobile that's going to insure the workers who are building their great cars. And we need to find a way to help stop that trend and actually reverse that trend. Our belief is that technology solutions play a critical role by improving access, by reducing the need for people to be experiencing what are otherwise very expensive in-person care delivery models. And we think that these solutions can also fill in the gaps where we have provider shortages. We know that it's just challenging to get in to see providers in certain markets. Being able to work with these virtual solutions makes a huge difference. And for employers, where they're focused is, rising cost of surgical care, rising cost of pharmaceutical care, dealing with challenges associated with mental health of the populations that are in their workforce. These are all areas where they're looking for offerings from companies like the ones that we support.
Is it fair to say then that investors are still backing quote unquote point solutions that might be a bit more condition specific, sort of at the same time that they're looking more at platform plays? Are you seeing sort of investments lean one way or the other at this point based on how employers are sort of thinking about this too?
Well, there's a lot of discussion about point solution fatigue. So many employers are using dozens of different solutions for their team members, and it's really hard to manage. But you need to establish trust with the end user. That consumer experience is critical. And so if you try to be all things to all people, it's really hard to build that trust. So many of the companies that are in market today start in a place where they're able to go in with an offering that people use. And then if they have related conditions, they'll grow with them and they'll continue to use other offerings for that company. And you earn the right to expand in those areas. And you earn the right with the employers to be able to demonstrate that you can deliver the value that I spoke to earlier. And I think the idea of being a mile wide and an inch deep isn't going to provide much value.
Are you seeing a rise in more outcomes-based models right now, or per engagement models versus more of like a PMPM or PEPM type of pricing?
I think that most sophisticated employers in this market have moved away from a PMPM, per member per month, per employee per month model, because you're paying for a lot of free riders. You're paying a low price, but it's not driving utilization. And we believe, and the models that our companies provide are virtually in all cases models that are either per engaged member per month or involve the shared savings type of opportunity. That means that you're totally aligned with where the buyer is aligned. And you want to make sure that your interests coincide, because if people use it and that's demonstrating value and the savings are then generated to the employer, then you've earned the right to participate in some of that value.
Yep.
But if you say, you know what, my model is built in a way that I'm actually not going to be incented to encourage people to use the solution, then the employer is paying for something that's like a check the box. Yes, we have this. We can, smile at a town hall meeting and say, boy, we're offering this. But if no one's really using it, then where's the beef, so to speak?
What is the role of the CFO here nowadays in these types of discussions with the benefits leaders, particularly as it relates to digital health vendors that, we're seeing varying levels of success from an ROI perspective?
Kirk, you must have been eavesdropping on my call just prior to this one, because we were having exactly that conversation. CHROs and benefit leaders are joined at the hip with the finance team, with the CFOs, in making sure that they're getting the most out of the dollars that they're spending. And there are many companies that have rich benefits and that are using that as a vehicle to try and attract team members, especially in highly competitive markets and highly competitive industries. But having said that, chief financial officers are now in the room when the decisions are being made, including with digital health solutions, as well as broader benefit decisions that are being made for the organization, because those cost trends that I spoke to earlier are just continuing to erode the profits and therefore the value that's being delivered to the shareholders of these organizations that are buying the offerings from these companies.
Yeah, I mean, you used the GM example earlier, which back in 2008, GM ended up having to seek a bailout and had to lay off a lot of employees because ultimately their percentage of revenue that was tied to healthcare benefits and to pension benefit liability started to approach 9-10%. And that actually is going to be where a lot of companies are in the US by 2030, where suddenly 9 to 10% of their revenue is going to be tied up in healthcare benefits as well. So you're going to be running into this situation where if the CFO and the HR team can't work together to come up with a sustainable trend strategy that is ultimately decelerating trend over time, it's going to result in a ton of really difficult, broader business implications and broader business decisions.
We know as a country that we spend a huge amount on healthcare. There's meaningful waste, and the outcomes are not what we should be achieving as a country. When you compare us to other industrialized nations, our results are nowhere near as good as many other countries that are spending far less on healthcare than we are on a per capita basis. So that's now making its way into the boardroom and into the CFO's office and saying, how do we make sure that the dollars we're spending are being as effective as they possibly can be?
And maybe that's partially the reason why it seems like it's been a slower market for digital health venture capital in the past few years. Are you seeing valuations come down meaningfully as a result of some of what we're talking about right now too?
So we've been investing at the earliest stages. We're seed and Series A investors. And because of that, even during the hype cycle of late 2020 and 2021, we weren't chasing the companies that had no revenue and they had a glossy PowerPoint presentation. They were looking for $100 million valuations. That was not our game. Since kind of 2022, a lot of the tourists have left the island, so to speak, and you now have far more disciplined investors. It's a little bit more of an investment cycle. And I'd say that other than the AI space, which has a little bit of irrational exuberance around it, I think we're seeing a very balanced approach between what investors are willing to invest at and what the companies that are being started believe is a fair valuation for their business. But I think gone are the days where you're looking at 50, 60 times revenue multiples for valuing businesses. And I never learned to value businesses off of revenue models. Like $1 of revenue for a software company with really high margins is going to be very different than a product company that has 20% margins, or even a healthcare business that might have 10% margins. Our hospitals operate at sub 5% margins. So how can you value them based on a revenue multiple when every dollar of revenue has a different profile depending on the nature of the business? So we got a little bit away from some of the fundamentals from a valuation standpoint, and I think that's coming back now in terms of how companies are being valued today.
You reference AI in sort of a different light, Lee, but I'm just curious, how has AI, if at all, changed the way that companies like 7wire, like you, are actually evaluating early stage companies? Are you guys using AI technology at all as part of that process?
Well, actually, everything I've said to you so far today was scripted by ChatGPT, so it's working perfectly.
You too? Okay, good.
So inside our own business, we're looking at every way we can be better investors using AI. We do a significant amount of sector research. We publish a lot of research that's proprietary, but we will use AI as a way in which we're gathering information. We have a database with tens of thousands of companies that we've gathered from the years of our being in business. We'll cull that information and use it in a way that helps us recognize patterns and what else do we see, what was different about that business model to what we're seeing today. So it is having an impact on where we are, and we're seeing more analytical tools that we can be using, some of which we're building and some of which we're acquiring to help us make better decisions as investors. But I want to make sure that I focus on one thing. We're early stage investors. What the business plan looks like when someone walks in on day one is very different when you look at that company 2 or 3 years down the road. But we spend a lot of time focused on building relationships, understanding the founder or the founding team, and for us, knowing them as people and their attributes as leaders. Those are the things that we look for more than just the financial metrics when we're making decisions. We're clearly weighing that far greater than what an engine might tell us logarithmically about the likelihood of success in a business, because that human element is going to make the difference between something that looks good on paper and something that's wildly successful.
And so far, AI hasn't caught up to kind of managing or measuring that subjective part of the human personality. So where do you think the next Livongo is going to come from?
Well, we think we have a few of those in our portfolio already. And so, look, Livongo had those elements that I spoke to before about phenomenal consumer experience, giving guidance to individuals to help them manage their health, and in that case, their cardiometabolic health, and providing a very strong return on investment. We see companies today that are growing dramatically, being able to provide terrific services. One of them in the portfolio in the severe mental illness space called NOCD. The founder, Stephen Smith, we gave him seed money, first $1.5 million institutional dollars into the business. Today, that company is well over $100 million in revenue and profitable. And I think that they are going to continue to grow in the severe mental illness space and make a huge difference in terms of care to allow people to live healthy and normal lives. And it's wonderful to see someone like Stephen having such great success. He had the lived experience himself with OCD and took far too long for him to get diagnosed. And he swore never to let someone else go through the same experiences that he had. And so every story that we hear that's coming from their users about how happy they are to have found the solution to their problems, not only is something that the company is doing well, but they're doing good. And we love the dual mission that so many of our companies have in being able to provide a far better experience for people while building a business that can be extremely profitable.
It's awesome. Excited that you keep doing what you're doing, and looking forward to seeing more great stuff that you're all working on as well too. And as always, we'll be back soon with more conversations with incredible health industry guests like Lee. So thanks for tuning in.
Kirk, thanks so much for having me on today.
If you're liking the conversation, be sure to subscribe so you don't miss future episodes. And if you've been enjoying Margin of Care, please leave us a review on Apple, Spotify, or wherever you listen. If you've got feedback or questions or something you'd like us to cover on the show, send us a note anytime at marginofcare@getgarner.com. We'd love to hear from you.